The London borough of Brent was hit hard by coronavirus. During March and April's peak, hospital admissions and deaths here were some of the highest in the country. But what if the rates of infection in this and other hotspots were enough to prevent the virus spreading in them again? Could herd immunity to COVID-19 be closer than we think? Professor Sunetra Gupta suggests it could be, and a strategy that ignores it is wrong.
The strategy that a welfare state should take at this point in time is to shield the vulnerable and allow the infection to spread amongst those who are not at risk of death. We've put in place a system that doesn't protect the vulnerable, and now we're asking those who are economically vulnerable to pay for that. It's unacceptable to me.
In theory, herd immunity is reached when enough of a population becomes immune to a disease to stop it from spreading. Many experts assume 60 to 70% would need to be exposed to COVID for that to happen. But others now predict 30 or even as low as 15% exposure could be enough to stop a second wave. The latest ONS figures for England estimate that nearly 10% of Londoners tested positive for antibodies to the virus. In the northwest, 6.8%, and in the West Midlands about the same. But in places like the southwest and the southeast, it's much lower.
It's time for me to give my second sample to UK Biobank's coronavirus research.
Thanks to volunteers like Nikki, soon we'll know more. Researchers are taking and archiving COVID-19 antibody samples from 20,000 British people over time, the largest study of its kind in the world. Among certain groups in the capital, they've seen antibody rates around 17%.
Is that enough to give herd immunity, to protect the rest of the population?
I would say we really don't know. There isn't enough population-based evidence about how long natural immunity lasts. You know, if the antibodies only last a couple of months, then herd immunity, frankly, is a no-go.
But could herd immunity be emerging in the real world? Manaus in Brazil saw one of the world's worst COVID outbreaks, but cases are now falling there despite any lockdown measures. Sweden's herd immunity strategy is widely seen as a failure, but cases and deaths are falling there too, with similar antibody levels as the UK. But the World Health Organization warns herd immunity shouldn't be a policy.
Overall, a large majority of the world's population today is still susceptible to this virus. And so the risk of imagining that herd immunity will likely develop and will put a natural stop to the transmission is in the process. You're going to have a lot more people getting sick and a lot more people dying.
An effective vaccine against COVID-19 would end the debate. But if it's slow in coming, we may not have a choice over whether herd immunity works or not.
And Tom is here to talk about this. Look, this is a massively important debate, isn't it? It has huge potential consequences of how we handle this pandemic this autumn. What do you make of that debate?
I mean, I really think it could be. You're absolutely right. If we'd gone for a herd immunity strategy at the beginning, I think it's clear now it would have been a complete disaster. We were unable to shield the most vulnerable. The situation in care homes made that very clear, hospital outbreaks. It would have been a disaster. But now something interesting is going on that's making people listen to Professor Gupta's research with a little bit more renewed interest, because it was quite heavily criticised at the beginning, because we are seeing continued transmission. We've lifted lockdown measures, transmission is going on, but we're not seeing a return of cases and deaths, particularly in the most hardest hit spots. What is that telling us? Some people are saying maybe we need to sort of look at a strategy that encompasses that. Others, I think quite rightly, we just don't know enough yet. It's a risky thing to do. But if that vaccine isn't forthcoming quickly, we're not really going to have any choice. You know, we are going to be living with this virus, so we need to start thinking urgently now, having a debate about what level we're prepared to tolerate in society.
OK, Tom, thank you very much indeed.